Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone and welcome to our today's lecture about tissue repair. First of all, I'd like to introduce myself. I'm Dr. Safaa Mahmoud, lecturer of pathology. And today's lecture is about tissue repair or healing. First, I'd like to introduce a concept. Let's imagine that you are on your studying room, and you have your lovely photos in front of you, like this line or others. These photos are getting torn with your young brother. So, what are the thoughts that coming in your minds at that moment? Let's say that we have a piece of wood. Let's say that we have a piece of wood like this one, and sticking to this wood another photo paper with your lovely picture, sticking to this, like say it's flower, for example. Then your brother comes and getting it torn into 3 or more pieces like this. It becomes like a jigsaw puzzle actually. Here are the pieces. So we have here pieces of the photo, of your lovely photo, and we have the piece of wood that your photo was sticking to it. I think at first you have to think about repairing it by collecting these pieces together in order to resume the overall photo and getting it kept on your desk. So you will come and get together, sticking together in order to keep your photo intact. Is that right? Then sticking it again to the piece of wood. Well, so if your brother is a little bit vigorous and he broke also the piece of wood, then the situation will become difficult. We have to repair the piece of wood and the photo cover. It will be difficult. You may search for something like plastic or other material to close the holes made by your brother. So you have two options. The first option, that here the piece of wood is intact. The piece of wood is intact, and you could stick the torn pieces on it to resume your lovely photo. Is that right? This is the option, the first option. So this is one. Or another option, that your piece of wood is torn and then you have to bring something else like plastic or something of other material to close this gap formed by breaking it. Let's say let's make it in blue, for example, because it's another material. And then you may not be able to stick the photo well, so it will become a little bit disrupted and you may buy another one by the end. I want to say that this is what are we doing as tissues. This is what our body respond to different injuries. Let's imagine that your brother is the stressful insult or the injurious agent, and you have this photo paper. I will call it cells. So you have cells. So if the cells are injured, it then try to reproliferate and regenerate in order to come again to the original functional and architectural normal. And we have the piece of wood that I called here in tissue bodies extracellular matrix. So we are as a cell like this picture or this photo. cells are trying to regenerate and replicate in order to resume its original function and architectural figuring. However, in some occasions, these cells cannot do the proper regeneration or the proper proliferation because the piece of wood here is also injured. The piece of wood here, when we apply it on tissue, we say that it's extracellular matrix. So now let's imagine that we are in liver, for example, and we have lobules of liver. Lobules of the liver cells are arranged in plates. And these plates actually are deposited in what's called extracellular matrix or ground substance, full of connective tissue, fibroblast, maybe blood vessels, some deposition of material whatsoever. So now, if the injury is affecting only the hepatocytes without affecting the extracellular matrix, like here, affecting only the torn piece of paper without affecting the background of wood piece, then they could regenerate again in the same pattern, and the whole overall picture will come again to normal, to its original normal. But if the extracellular matrix is affected, then the regenerating cells will be haphazardly arranged, like in nodules. The regenerating cells will be haphazardly arranged, like in nodules, like this and this. And the extracellular matrix will be something like disrupted and become like this, for example. So here there is no original hepatic lobules could be restored. However, the cells can regenerate. However, the cells comes back with regeneration, but the overall picture, the overall function and architecture is disrupted. So now this is the process of healing, which is formed of many circles. The first circle is regeneration. We have many circles. The first circle is regeneration, or proliferation of the cells. Depending on the degree of the cellular injury, it may be a mild injury affecting only the cells. So this regeneration will bring the photo normal, or back to normal. However, if the injury degree was great and affecting the extracellular matrix, this regeneration will not come back to normal because there will be eventual change in the function and architecture. So first of all is the proliferating cells. Second circle is the extracellular matrix. We referred before to the piece of wood here on the photo. The third cycle actually is what's called growth factors. What are growth factors? It's not a photo, it's not non-living things. We are as cells living. So in order to regenerate, in order to replicate, we need, I'm talking on behalf of cells, okay? So cells, in order to regenerate and to replicate, it needs growth factors to promote its replication, to promote its migration, to promote what's called the healing process. So we need growth factors to promote the healing process. This is an overall idea. I want you to understand that healing depends on the type of cells. Are the cells capable to regenerate or not? The degree of injury, the presence of extracellular matrix, and the growth factors. Now, let's say that there is some piece of these pieces are lost totally. Or all pieces are too small to bring them again back. or the pieces are made of a material that is not fit to be glued again together. So I think it's difficult to restore our photo, and we may bring other tissue to replace it, even if the extracellular matrix or the piece of wood is intact. But now the material itself is not fit for being stuck together. I mean that the cells have different types. Some types can proliferate and regain its original function and architecture, and others cannot. And others are standby. They could proliferate when only injured or when only stimulated, and then getting in a stable state. So again, let's come back to our PowerPoint presentation. Our ILOs today is to know the definition of repair and to differentiate different types of cells. What are the type of cell that could proliferate? What are the cells that couldn't proliferate, and then we have to replace it with another type of tissue when injured? What are the types that could proliferate only when stimulated? And so on. We need also to identify the characteristic features of different cells. Give examples of each type of cells, and then classify healing response in relation to the type of injury. Well, what are the definition of tissue repair? As we told you, restoration of tissue architecture and function after an injury, restoration of your photo architecture and function after an injury. And this occurs in two ways: either regeneration of the injured tissue, and we say that some cells can easily regenerate, or the second way is replacement by other type of tissue. What are the type of tissue responsible for replacing any other tissue injury? It's a connective tissue. It's the connective tissue. So replacement by connective tissue is the other way in tissue repair, and we use it only if the cells cannot regenerate, or if there is great affection to the extracellular matrix. So now we call for connective tissue. Come here, please, and replace this injured area, because we cannot replicate and we cannot regain our normal function. This process is called scarring. So when I ask you what is scarring, it's replacement of injured tissue by connective tissue or by fibrous tissue. Scarring or fibrosis or healing by connective tissue is almost synonym to each other. However, using the term connective tissue is not that accurate like fibrosis, because connective tissue is normal. However, fibrosis is not normal. Well, so usually tissue repair involves both processes. Involves cell proliferation and interaction between cells and extracellular matrix. Now we are going to discuss the four circles of tissue repair. First of all, we have to know the degree of injury, because if the degree is minor, then proliferation could occur and restoration to normal function and architecture will come easily. Cell proliferation, if the cells are able, if the degree of injury is great, then we have to call other type of tissue, because the cells will not be able to replicate and regain its normal function. So now the degree of injury, if high, will call for the fibrous tissue or connective tissue and form the process of scarring and fibrosis. Cell proliferation, so that when the cells are able to proliferate, this is well and good. This will lead to restoration of function and architecture. If not, then again we will call for fibroblast and fibrous tissue formation with scarring and end in scarring process. The last thing, the two things, extracellular matrix, when injured, again we call for, say with me please, if the extracellular matrix is well injured, then the cell will not proliferate in the same directions of the original photo that Allah created. Okay, so it will disrupt the tissue architecture will disrupt it, and when the tissue architecture is disrupted, the function again is disrupted. And all of these processes need growth factors in order to process, in order to proceed into the healing process. I hope to get the point. I hope that you got the point I need to introduce to you. So we need to know what are the types of cells, and what is the degree of injury, what are the growth factors, and what is the role of extracellular matrix in healing process. Look, this is normal skin. This is a normal skin. When we are doing like mild superficial injury, not affecting the basement membrane, then we can regenerate, the cells can regenerate again into normal and restore its original function and architecture without any problem. However, here, if the extracellular matrix affected, representing in the basement membrane, extracellular matrix here in the skin representing in the basement membrane. If the basement membrane is affected, then the cells, when come to regenerate, it could not be able to restore the normal function and architecture. So they call for fibrous tissue and scar tissue formation, like this one. So when you injure, the injury, even you, think about it. If you are injured, a minor injury, the cells after 10 days of your skin, the skin will come back to normal. But if your injury was great, deep and large, big, it takes longer time, maybe weeks, and then end by something different in color. This difference is called scar formation. Here, this is the normal hepatic lobules, and these are normal portal tracts. So if we are going to injure the hepatocytes only without affecting, and in between, look, in between this blue color is the extracellular matrix, sinusoids and extracellular matrix. Then if the only hepatocytes are affected or injured without affection of the extracellular matrix, like this photo, again regeneration will occur and restore the normal function. However, if the extracellular matrix is also disrupted, regeneration occur, however the normal architecture is not again back to normal. We may not be able, the cells may not be able to regenerate completely, and then call for connective tissue, fibroblast, and other cells to replace it. What's called repair by scarring. Here, what is deposition of connective tissue proliferation within the deposition of connective tissue and proliferation of residual cells within the disrupted matrix. Well, so let's define some things. Regeneration is replacement of diseased or damaged tissue by proliferation of parenchymal cells. This leads to complete restoration of the original tissue. However, scar formation or repair by connective tissue laying down, when the tissue is capable of proliferation, this occurs when the tissue is incapable of proliferation or supporting framework or extracellular matrix is damaged. Now, let's know about the types of cells. What are the types of cells? What are the cells that could regenerate and then restore the normal function and architecture? And what are the cells that couldn't regenerate, and when injured, they call for other types of tissue to replace it? And here, fibroblasts are called to form fibrous tissue, and the repair occurs by connective tissue laying down and scarring by the end. The types of tissue are labile, stable, and permanent. Let's take a hint about the cell cycle at first. G1. G1 here is responsible for replication of RNA and different proteins of the cells. Well, but when it comes into this S stage, there is replication of DNA and DNA synthesis. Again, it entered the G2 phase. The G2 phase is responsible for getting it ready to divide, getting the cell ready to divide by mitosis. And after mitosis occurs, each cell, the mitosis is aligned in two lines, and after that each cell will bud out of the original cell and become two cells. So G1 stage is the synthesis of RNA and proteins. S phase is the synthesis of DNA. G2 is the correction of synthesized DNA. And M phase is the formation of two daughter cells. This is in general. What's called prophase, metaphase, and anaphase, and telophase. However, some body cells cannot go into this cycle at all. تمام? This is number one. Number two, mitosis is regulated and controlled by genes like cyclins and cyclin kinases. This is another photo of the cell cycle, more simplified. This is G1 phase. Here, G1 phase. The cell usually in the GO, quiescent or stable, don't replicate. They don't want to replicate, like in hepatocytes. After getting in G1 phase, the cells able to replicate. Some cells are usually in the G1 phase, like the epidermal cells. But nothing of these cells coming here except if needed. So, again, G1 phase, growth factors stimulate the transition from GO phase into G1 phase, and then progression into DNA synthesis, what's called S phase, G2, and mitosis phase. Once the cells enter the S phase, their DNA is replicated and progress through G2 and mitosis. Well, now back to the types of cells. What are the labile cells? They are the continuously dividing tissue, present usually in the G1 phase, as I told you before. So, cells are continuously proliferating, can easily regenerate. Is that right? Yes, they can easily regenerate after injury, as long as the extracellular matrix are preserved and not disrupted. Okay? You can easily regenerate after injury under appropriate conditions, like the presence of growth factors, the presence of good blood supply, good nutrition. Of course, because in order to regenerate as a cell, they need some things, many things actually, to replicate and regenerate. Well, like what? Give examples of these labile cells. The surface epithelium, either of the GIT or the respiratory, urinary, reproductive, All surface epithelium are labile cells, continuously dividing, able to regenerate as long as there is no disruption of the extracellular matrix or basement membrane. What else? The surface epithelium of the cornea. So, if there is minor degree of corneal injury, it could regenerate and become again as normal. If there is major degree affection of the basement membrane, the cell will regenerate, however, no restoration to normal. There is recalling for fibrous tissue to come in and cause what's called fibrosis and scarring formation with loss of vision or affection of vision. Epithelium of ducts and exocrine glands are capable of continuous dividing. Of course, why not? Because they are continuously need to secrete many hormones. They are continuously injured, maybe by HCl if they are in the liver or what's on. If they are in the stomach and what's on. Cells of bone marrow also are continuously dividing tissue. Cells of the lymph node, cells of the spleen also are continuously dividing tissue, the bile cells. When injured, if there is no affection of the basement membrane or extracellular matrix, they can easily regenerate and restore their normal architecture and function. Stable cells or quiescent tissue. Normally, they are in the GO phase. Cannot proliferate if injured. They are in GO phase, however, they can proliferate if injured, with limited ability to regenerate. Well, they are stable, they are all life, but when injured, they getting in G1 phase and S phase and then regenerate and replicate just in one condition: if the extracellular matrix is not affected, restoration to normal architecture and function will eventually happen. What are the types of stable cells? Parenchyma cells of organs like liver, kidney, and pancreas. Mesenchymal cells like vascular endothelial cells, fibroblasts, smooth muscle cells. Non-dividing tissue. From the beginning, the cell cannot replicate. So minor or great injury, affection of extracellular matrix, or without affection of extracellular matrix, these cells cannot replicate and eventually call for fibrous tissue formation, connective tissue laying down, fibroblast proliferation. All of these things we will discuss later on. So don't be panic. I just want you to understand the overall concept. If the permanent cells is injured, either minor injury or great injury, scar formation will eventually happen. The scar formation process, we will discuss it later on. However, I want you to understand that these cells are not capable of dividing and are replaced by this scar tissue. Well, for example, terminally differentiated cells cannot proliferate, cannot regenerate, like neurons, CNS. Yes, CNS is one of the highly differentiated cells and never regenerate or overlife, even if injured. So someone who are exposed to stroke, for example, hemorrhage in the brain, then he will lose the function. He will live in what's called hemiplegic status, or lose the function to move or to talk and so on. In brain, it's not a fibrosis, it's gliosis. Not the fibrous tissue that replaces the neurons, but the glial tissue of the brain. It's synonym to fibrous tissue, a little bit different in structure. However, the process of fibrosis in brain is called gliosis. But here neurons have a little bit nice capability that the living neurons could overcome, could override other functions. For example, if as a cell specialized in only movement of the arm, it can by time specialized in two functions rather than one, what's called neuroplasticity. This neuroplasticity making the overall picture of stroke patients getting improved. So improvement of stroke patients is not due to regeneration of neurons of the brain tissue. It's only due to neuroplasticity. The permanent cells also, our non-dividing tissue also, like cardiac muscle, like skeletal muscle, like lens of the eyes, and so on. Sorry for interruption, and again back to you. So these are permanent cells. Well, just remember that when we injured only the cells could regenerate, but if the extracellular matrix is affected, this repair will occur by scarring, and we will discuss scarring later on in the foregoing lectures. And if the cells are dead, regeneration depends on the type of cells. If they are labile or stable, they will regenerate, and if they are not, they will bring scarring to the tissue. Other types of cell I want you to understand, what's called stem cells. What are stem cells? Stem cells are cells that has the ability to continuously divide and differentiate into various other kinds of cells. We know that liver cells, when injured, it replicate into liver cells. Is it right? Yes, it replicates into liver cells, not into brain cells, not into muscle cells, not into epithelial cells. It replicates in the same type or kind of its original type. However, stem cells could replicate into different cells, could replicate into brain tissue, could replicate into epithelial cells, could replicate into whatsoever. So these stem cells are usually present in the embryo, intrauterine, because stem cells should differentiate into different organs to form different organs of the body. However, in adult, stem cells are present, but to a lesser amount in different tissue, and they are able to differentiate into different types of cells. However, there are types of stem cells. So stem cells are characterized by prolonged self-renewal capacity achieved through asymmetric replication, in which with each stem cell division, one of the daughter cells retain its self-renewing capacity while the other enter a differentiation pathway. What does that mean? Okay. Stem cell. Let's go back to the normal cells, epithelial cells. Let's say that epithelial cells will replicate. Epithelial cell will give two daughter epithelial cells. However, stem cells, when replicate, give one daughter stem cell like the original mom, and the other cell will differentiate into different pathway, into epithelial, into hepatocytes, into brain cells, and so on. Not brain cells in adult actually, but into hepatocytes, into ductal morphology, into epithelial morphology, and so on. So stem cells can go, but this is also an important a piece of knowledge. You have to know that stem cells can go into unlimited number of cell cycles. Unlimited number of cell cycles. Okay, these are stem cells. Stem cells are present in the base of the epithelial. This is a squamous epithelium. Okay, stem cells here in the basal layer between basal cells. When they proliferate, they form baseline cell population. Again, they proliferate, some going back to stem cell, and others differentiate into squamous epithelium. But actually, these stem cells should not proliferate vigorously, because they will form tumor if so. So they should, under the proper and normal circumstances, be controlled, very well controlled by the growth factors to guide these cells either to differentiate or to die by what's called apoptosis. Well, let's take a hint about the types of stem cells. Embryonic stem cells. Embryonic stem cells, they are the stem cells that usually present in embryo. They are pluripotent. That is, they can differentiate into all cells of the body, isolated from the inner cell mass of the blastocyst. Of course, this is an normal embryonal development. How can we use this embryonic stem cell? In the future, we can use it to repopulate damaged organs. We will extract the stem cells from the embryo, from the inner cell mass of the blastocyst, and under proper culturing situations, proper growth factors, mediators, and so on, hopefully science could be able to repopulate damaged organs like liver, like brain, like muscles, by this type or kind of stem cell. Adult stem cells, so the embryonic stem cell only in embryo, and could differentiate into all types of all types of body cells. However, adult stem cell found in various tissue can divide forever without terminal differentiation and differentiate into all cell types of their tissue, differentiate into all cell types of their tissue. That's to say, produce cells that are specific for the organ at which they reside. For example, these cells are present in the epithelium, in the epidermis, and the skin epidermis. The stem cells of the skin epidermis can proliferate into either basal layer, basal columnar, or, sorry, I will go back here, like, let's say that is the epidermis, basal columnar cell, and then polygonal cells. That's right, you know that from histology. And at last, they become squamoid. That's right. Here the stem cell are reside. Here, like here. Let's say another color. Let's take other color. Here are the stem cells. When they proliferate, they could proliferate into basal, columnar, or polygonal, or squamous. Let's say in the stomach have many types of cells. Columnar mucosa, this is the lumen, and this is the lining. Columnar mucosa, glands, different types of glands. So here are the stem cell. Stem cell able to proliferate and give either surface epithelial type cells or any type of these glands. So stem cell in adult could differentiate into all cell types of the organ they reside in, not other organ. Okay, you all understand? Of course, sometimes there is exception. However, I want you to understand to that limit. Back to the PowerPoint presentation. This is the hierarchy of stem cells. Self-renewal could replicate into the same cell type, what's called totipotent cells, capable of dividing and developing to form complete mature organization. Are pluripotent cells, capable of developing into many different cell types. Multipotent, but limited lineage, like hematobiotic. Oligopotent, few cell types, capable to differentiate into only few cell types. Unipotent, capable to differentiate in only one cell type. Okay, now we finished the first lecture. So please, if you want anything, don't hesitate to send me a message on my email, Safaa Mahmoud at med.asu.edu.ag, or text me WhatsApp on this number. Thank you for watching and waiting for the next lecture. Goodbye.